Cancer survival in the UK is poorer than the European average, and we know that one of the reasons for this is delay in diagnosis, and sometimes this is due to patients delaying going to their GP. This might be because they're not aware of the signs and symptoms of cancer, or it might be that they're scared of a cancer diagnosis. In response to this, the government introduced a national awareness campaign called Be Clear on Cancer. This campaign features the key cancer signs and symptoms and advises people to go to their GP quickly if they experience any of them. Now, newspapers are a key target for this campaign, and this is because there's an assumption that the newspaper format will allow the campaign call to action to be retained in full. However, no one has ever actually evaluated whether or not this is the case. Furthermore, there's very little research out there about how UK newspapers write about cancer, and this is important because language influences our perceptions, such as our perception of cancer as a disease that should be feared. So I undertook an interdisciplinary multiple method study, and I looked at nearly 450 newspaper articles across 5 different types of cancer. I looked at stories that were about people, as well as articles which were explicitly about these campaigns. I undertook a content analysis and counted the number of times that these key awareness messages appeared in the stories. I undertook a corpus linguistic analysis, which is a computer-assisted way of looking at the pattern and structure of the language. And then I undertook 14 qualitative interviews with journalists and people who write PR to try and understand why I got the results that I did. And what I found was that newspapers have a tendency not to be very informative. In the general articles, fewer than 10% contained any awareness information at all. But even in those articles explicitly about the campaigns, 30% did not make clear why it's important to get an early diagnosis of cancer. The people featured in the stories tended to be below the age of 50 and from higher socioeconomic groups, and therefore do not reflect the people in the population most likely to get cancer. Cancer tends to be framed in terms of negative outcomes and unpleasant treatments, and therefore doesn't reflect contemporary medical opinion that cancer is treatable if diagnosed early and that those treatments are improving. And finally, there was a lot of use of battle metaphor throughout the stories, and we know that this is a particularly contentious metaphor for people who've had cancer, owing to its potential associations with blame. So taken together, these findings may skew public perceptions of risk and reinforce those emotional barriers to GP presentation. However, when I spoke to the journalists, they said that the reason for these findings is likely to be journalistic norms and processes, and actually that scope for change at their end is very limited. So I think that future research in this area needs to look more about how we can improve our own PR, how we can better target specific publications with specific target audiences, to better disseminate our messages and ultimately improve survival of cancer. Thank you.